Hello, I'm Bonni Elewski. I'm professor and chair of dermatology at the University of Alabama in Birmingham. I also have been residency program director in the past, and I found this paper particularly interesting. The paper was entitled Dermatology Residency Applicants Concerns Due to COVID-19, and it came from the University of Illinois at Chicago. Now, we all know that COVID-19 caused substantial disruptions to medical education. And this paper explored how these disruptions affected medical students applying to competitive residencies such as dermatology. So 240 medical students were sent an anonymous survey. Those applying for the recent match cycle, the match of 2021, and those applying for the upcoming match cycle, 21-22. And keep in mind that in the past year, dermatology resident interviews were all virtual. Plus, there were no away electives for interested medical students, which affected their knowledge of programs, their ability to obtain quality letters of recommendation from programs. It also affected programs' knowledge of the students. So it actually went both ways. And students without a home dermatology program, I think, had particular concerns on many issues and reasons for concern. So the paper looked at the concerns these students had regarding the COVID pandemic and asked them to develop some solutions so this can be improved for this upcoming cycle. We still don't know whether interviews will be virtual or live at this point. So 70 or so people responded to the survey. That's about 1/3, since 240 medical students received the survey. And questions that were statistically significant. There was a big problem with research project change. Students expected to do research at a visiting program couldn't do it. That was especially a problem with those students without a home dermatology department. There was a lot of concern on lack of in-person interviews, particularly for underrepresented minorities. Medical students in the third year, MS3, were very concerned about the effect of COVID on test scores. And I know medical students did have a lot of problems with taking tests, such as step 1, step 2, because the test would be changed. The date would be changed. The timing of the test would be changed. The city they may take it would be changed. So the cost was going up. And the cost and the circumstances surrounding the test could affect adversely their test score. Both underrepresented minorities and those without a home dermatology department had concerns about their clinical experience, the lack of clinical experience that they would have in not visiting the other programs. There was also a general concern for not obtaining a good sense of the culture of the program that they would have interviewed with. And the virtual electives, which were not offered at all programs, but there were complaints that these are not sufficient to obtain enough program information to see what the residents are really like and to understand the program culture. And those without a home dermatology department and underrepresented students, as well as the MS3 students, were very concerned about obtaining quality letters of recommendation. So they had lots of concerns and reasons for concern. So what were the students' proposed solutions? They suggested virtual meetings with program leadership and virtual meetings with residents. Also a virtual mentorship, a virtual electives. Some programs did offer it, but maybe making it a little better. They also recommended that those medical students that obtained interviews should have second looks at this program to gain more insight into the program culture so they understand the program better before they put it in the match list, and also to interact with other fellow applicants. And to make it worse, there were more people applying for the dermatology match list last year, which made the situation even more competitive. So I find this paper very interesting and timely. We're facing a similar situation. We don't know at this point whether interviews will be virtual or live. I'm hoping that this year we'll have live interviews and we're allowed to have residents or medical students rotate with us. I think that will happen going forward, but you still don't know. There's a lot up in the air. The limitation for this paper is the small cohort size. But I think they brought up an important point. We should have a holistic review of applicants with emphasis on the distance travel for programs to use in going forward to select a nice slice of the country for each residency program.